Welcome to Doctors on Call. I'm Jenna Miller. It's a new year, but the COVID virus is still widespread with more than 400,000 new cases and over 100,000 hospitalizations across the country. How do you know if you have a cold, the flu, or COVID? What should you do if you are exposed or test positive? It's a new year. Do you have any weight loss goals you would like to pursue? We'll tackle these issues and any other health issues you might have questions about on Doctors on Call with our guest, family physician, Dr. Tyrell Summers.
Presentation of Doctors on Call on Smoky Hills PBS is made possible in part by an underwriting grant from at Blue Cross Blue Shield of Kansas. We're committed to being a healthcare partner you can turn to. That's why we're simplifying the health insurance experience so you can feel more empowered in your health.
Hutchinson Regional Healthcare System. Our family caring for yours.
At Osborne County Memorial Hospital, our services range from clinic visits to inpatient and skilled care, but our specialty is you.
Your family is our family. The staff at Smith County Memorial Hospital wants to set the standard of excellence for healthcare in north central Kansas.
Russell Regional Hospital, experts, neighbors, friends.
Dr. Tyrell Summers received his medical degree from the University of Kansas School of Medicine in Kansas City, Kansas. He completed his residency at the University of North Dakota Center for Family Medicine in Bismarck, North Dakota. Dr. Summers is board certified through the American Board of Family Medicine and is a member of the Kansas Academy of Family Physicians, American Academy of Family Physicians, and the American Medical Association. His professional interests include chronic care management, gastroenterology, pain management, and psychiatric disorders. Dr. Summers has been affiliated with Russell Regional Hospital since 2015. Our phone lines are now open at 1-800-337-4788 toll-free if you have any questions regarding COVID or any other health concerns you might be facing. Doctors on Call brings you information which may be useful to you when you see your own physician. Let's go ahead and get started with some questions of our own while we wait for those calls to come in. Thanks so much for joining us again.
Thank you.
Let's first talk about what are some of the current CDC guidelines regarding COVID?
Yeah, so the CDC continues to change guidelines when it comes to COVID as far as like the amount of time that isolation has to occur, as well as when someone should test. The biggest thing to remember is that those guidelines are ever changing. The one thing I would say for sure is if you have any concerns or questions specifically about whether you have COVID or not, to get in contact with your local healthcare providers, as they'll be able to help you navigate the ever-changing guidelines. The biggest thing is it depends now upon like exposures as well as your vaccination status, how long you need to isolate and how long you need to treat for. There's also treatment guidelines as far as those people that need like more advanced or more aggressive treatments for COVID-19. It can all be very confusing. So the most important thing is please reach out to any healthcare provider and they'll help you navigate that as best as possible.
Now, what's your suggestion if a person suspects they might be COVID positive? How important is it to go get tested? Do they need to, what is the process that they need to?
Yeah, so I can tell you what we do at our facility at Russell Regional Hospital. We have phone nurses that are dedicated to kind of screening calls for patients who have symptoms that might be consistent with COVID. Once you could call and talk with them, they'll either mark you to come into the clinic if they think that you have very severe symptoms. They might even encourage you to go to the emergency room if they think you're very severe. But if you're very mild, kind of moderate, and you just would like to know if you have COVID or not, they'll normally have to come you through a drive-through testing process where they go out and they'll have a nurse come and swab your nasal passageway and test you for COVID-19 along with some other diseases normally too. And then they get the results back to you. Most average tests take about an hour and a half to get back. There are some that take a little bit longer, and some facilities are different. They don't quite have the technologies or the same types of things that we use at Russell Regional Hospital, so they might have a different process. So if you have any concerns or questions, you can always call your local provider if they'll be able to help you get through that.
And how accurate are the home tests?
Yeah, so there's been a great kind of expanse in home testing that's been made available. They're antigen-based testing, and they're honestly very good, to be truthful with you. The biggest thing I tell most people is they're very good in detecting COVID if the person has symptoms. And so if you're testing it for screening, there's a chance it may not catch if you have COVID-19 or not. And if you're very early on in the disease, there's a chance it may not catch you as well. But if you have like fever, if you have like the loss of taste, loss of smell, cough, any of those side of symptoms, they're fairly accurate in detecting whether you have COVID-19 or not. So they're a good alternative if you're having a hard time getting a hold of your provider or can't get testing done sooner and would like to know.
Okay. We've got a caller on the line ready to ask a question. This is Christina on the line from Bern. Hi, Christina. Go ahead with your question for Dr. Summers.
I got, unfortunately, I caught COVID the first week of November. I was extremely ill for about 3.5 weeks. I am now experiencing some what I call aftershocks. I can't breathe very well, and I caught some other, I think it was pneumonia that my doctor said. Are these going to continue for a long time, or am I over it? Thank you so much.
Yes, thank you for your question. I appreciate that. So what our caller Christine was describing was kind of some symptoms that she's had post-COVID, and they kind of progressed for a period of time. Unfortunately, some individuals that experience COVID end up with what we call long haulers COVID syndrome, which can basically be a myriad of different symptoms that can happen upwards to a month, even all the way up to 6 months into a year after receiving COVID. For the most part, the majority of individuals do get better with time. The biggest thing that I experience, or at least I've seen my patients experience, has been shortness of breath with exertion. And so as the person kind of moves around, as they do more, they get a lot more short of air and they have a hard time breathing because of it. Some people are more susceptible to infection, just like Christine sounds like she was. They can get like secondary bacterial infections, which need treatment from a doctor. For the most part, that happens because COVID can be really hard on your immune system. And because of that, it can set you up for those types of infections. So if you have any concerns, it's definitely wise to see a provider. They can diagnose those very easily, but just know that the symptoms can persist 4 weeks, sometimes even longer than that.
All right, we've got another caller waiting to ask a question. This is Rod on the line from La Crosse. Hi, Rod. You are live on the air. Go ahead with your question.
Yes, I'm wondering about lower back pain. I've had. Okay, all right. Yes, about lower back pain and that in the fifth lumbar vertebrae there mainly, and I've had like 4 different epidurals in that location there, and I still have all kinds of pain.
Yes, thank you for your question, Rod. I appreciate that. So you're talking specifically about lower back pain in the L5 region, which would be the fifth lumbar vertebrae coming down off of the back. It's a very common area that's injured, and it's a very common area where chronic pain can originate from. The most common cause of chronic lower back pain is spinal stenosis, which is basically where degeneration or arthritis is kind of built up into the spine, and it causes a compression against nerves that can cause kind of symptoms down the legs, sometimes numbness and tingling, sometimes just pain. It can worsen with movement, especially while going like up and down stairs. Going down a hill can sometimes worsen it. Normally epidurals are a pretty good option for treatment for that, because you can go into the area where the compression is happening and treat it with medications to reduce the swelling and reduce some of the discomfort that's there. There are myriad of different things that can cause low back pain. Sometimes it can be caused by just arthritis itself. Sometimes it can be caused by autoimmune disease. Sometimes it can be caused because of injury or fractures. There's tons of different things that can cause low back pain. Spinal stenosis, though, is very common. It's very well treated with epidurals, but sometimes it does persist for a long period of time. And unfortunately, the root cause of it is from arthritis normally, and that's just something that is built up with time. So hopefully we can get you helped with your back pain. It's one of those things that's a tricky thing to handle.
Excellent. I want to go back. Christina had talked about, your long haul COVID, like you were talking about, and something that I hear a lot of is the loss of taste and smell, and how some people aren't getting that back until a year later. Why is that a symptom, and is there anything a patient can do to try to get that back?
Yeah, so that's a great question. It's definitely a very common symptom that happens with people with COVID. Normally most people get that back within about 3 weeks post-infection, but there are some that persist all the way up for a year, if that's 100% true. Some have not even received their taste or smell back at all. What we believe happens is that the coronavirus can store itself within the olfactory bulbs of the nasal passageway, and because of that, they can cause permanent damage to the very thin and fragile nerves in that area. And because of that, sometimes the loss can be permanent. Nerve damage is a lot different than regular kinds of damage. Regular tissue can heal within about 1 to 2, maybe 3 weeks. Nerves take a lot longer, 6 months, sometimes even a year. But if that damage is permanent, it might be something in which they lose altogether. Now, taste is tied completely with smell. The two of them are crucial and critical together. They're dancing partners. They work together. If you lose smell, you're going to lose taste. If you lose taste, smell isn't going to be as good as well. So if one goes, the other one will commonly go as well. So there's no real good remedy for it. Like you see a lot of these home remedies on like the different social media things. There's ones I've seen where people like burn oranges and do all sorts of crazy things. None of them have been proven scientifically to help with taste. The biggest thing is to just allow your body to heal and to get better slowly with time.
Everyone's desperate to get their taste and smell back right.
Agreed, 100%.
Now, how do you know between the difference between a cold, flu, COVID?
Yeah, that's a great question too. They're all similar. That's what makes it very, very challenging. Coronavirus, before it became SARS-CoV-2, or at least this variant of coronavirus, is one of the most common causes of the common cold. And so a lot of the symptoms match what we see during cold season. Influenza is very common as well. You can kind of tell a difference between influenza and coronavirus and common cold because influenza kind of hits you all at once. It's often like people describe it as like a ton of bricks hit you. People normally get like muscle aches, joint aches. They feel very tired. They can get fevers. That's normally a hallmark of flu. But I have seen some patients present that way with COVID symptoms as well. So the biggest thing is this: is if you have any of those symptoms, it's so much easier to just get tested and to know what's going on for sure. As treatments change, we might be able to help you even further get what you need.
And do you feel like the symptoms have changed with COVID since the initial onset?
Yeah, the different variants of COVID have had different kind of symptoms that have kind of fit into what they are. Like the Omicron variant, which is the newer variant that's kind of spreading right now, has a lot more gastrointestinal kind of issues that happen with it. A lot of the younger people have been telling me that that's kind of where it started. But some people have had cough, some people have had runny nose, which is what we saw commonly with Delta variant. The Alpha variant caused really high fevers, whereas both Delta and Omicron have not caused nearly as high variant or fevers as that variant did. So yeah, they've all kind of changed a little bit. They've kind of been a little bit different, but for the most part, they all kind of keep those same symptoms.
And do you treat differently depending on what variant it is?
No, so the variants are treated very much the same. They're all given the same medication, whether that be pre-hospitalization, during hospitalization, or even like the rehabilitation phase. They're all treated very much with the same medications.
And how do you know what variant you might have?
So normally you can do a test of the DNA, or I guess technically the RNA that's within the virus, and you can tell very quickly which variant that you have. The problem is it takes very specialized tests to do that. You have to be able to replicate and isolate that form of a nucleic acid and then test for it in a lab. At Russell Regional Hospital, we don't have that capability quite yet, but are working very hard to get that capability and to be able to tell people which variant that they're currently infected with.
Does it really matter what variant you have?
Not really. The biggest thing is it's just really good for record keeping and for us to know we've seen this is what's going around, so that we can inform people of what's going on.
And if a patient chooses to get tested and they are positive, what should they do next?
So the biggest thing when you test positive is to make sure that you isolate and still keep your distance from everyone else as much as possible. While you and your family may not be very prone to getting sick, which is wonderful, other people around you might not be as lucky. Some people are immunocompromised. Some people can't get the vaccine because their bodies just can't tolerate it or they have an allergy to it. Some people are just older and fragile, and so they can easily catch this virus and can get devastating effects because of it. So we still encourage individuals, when you've been tested, you're positive, to isolate. And that isolation time does vary based upon your vaccine status, based upon how sick you are, how young you are, depends upon even what work you do. Healthcare workers just recently had a change from the CDC in regards to how long they have to isolate. So the biggest thing, isolate, treat your symptoms. If you're having problems with fevers, coughs, those kind of things, over-the-counter medications that normally work for you are completely safe to try while you have COVID. If you have any severe health problems like diabetes, immunocompromised state, high blood pressure, even kidney disease, you might be a candidate for more advanced treatments for COVID-19. And so talking with your physician or your provider to determine if you would need those treatments is always a smart thing.
What can a person do, let's say at home, to try to prevent themselves from getting infected?
Yeah, just like any other viral illness, there are some things that you can do to help. Keeping yourself well healthy, exercising, and good diet is always very important. Zinc has been shown to help reduce the risk of producing any kind of like viral replication, so it's very good to take early on. I will tell people once you become sick or become infected, zinc isn't as much benefit. And the same thing happens with vitamin C. Vitamin C has been shown to show a little bit of improvement in viral illnesses, but not in the stage when you're infected, only in the pre-infectious stage, and helping reduce your chances of it getting worse. So those things are all great things you could try though.
Okay, and how important is it you hear a lot of immunocompromised individuals are the one that are getting hit hardest. What can those people do?
So in an immunocompromised individual, it's very important that you receive vaccination more than most individuals. You might need different booster shots. You might need different treatments based upon it. If you think that you're sick or ill when you're immunocompromised, it's very important that you talk with the provider very quickly, because some of the medications you take for your treatment of your different autoimmune diseases or cancer treatments, whatever you're immunocompromised from, might need to change specifically because of the illness that you've contracted. I have some patients who have rheumatoid arthritis, and they take very specific medications that compromise their immune system. If they become ill, they're not supposed to be taking those medications, so we ask them to hold it. They're also much more prone to need tested quicker. They're also the ones that might need the more advanced treatments for COVID-19. So it's really important that if you're a person who has that type of immunocompromised state, that you work very closely with your medical team, because they'll be able to help you out and navigate these very difficult pathways to get through.
And once you've been infected with COVID-19, is there a chance that you can get it again, or how does that work?
Yeah, that's a great question. So natural immunity definitely occurs when you get affected with COVID-19. Your body produces its own antibodies against COVID-19 that are very effective in stopping that variant of COVID-19. Unfortunately, sometimes that immunity does wear down with time. Especially if the variant changes. So for example, we just recently got through a Delta variant kind of rush that occurred, and we're starting to see Omicron pick its way back up. Individuals who had Delta definitely do have a little bit of immunity against Omicron, but they can still very much get Omicron. The same thing's true with people who get vaccines. All because you've been vaccinated doesn't mean that you won't catch coronavirus. You can still easily catch COVID-19 without any difficulty with someone who's vaccinated. The benefit to vaccination is your body has those antibodies to help fight COVID-19 when it sees it. Same thing is true with natural immunity. You have some antibodies against the virus, you might be able to fight it a little bit better, which reduces your chance for severe illness, reduces your chance for hospitalization, which is important.
Now, speaking of hospitalization, I think something that would be important to talk about is patient-informed consent. Tell me what that is.
So patient-informed consent basically is what a doctor does when they speak to a patient about treatment options, so that they understand fully what is going to happen to them within a facility. So for example, if I want to do a specific treatment for a patient, I need to be able to explain to them fully what's going to happen with that treatment so that they understand it, okay? It's very tough sometimes because as a doctor we speak in medical jargon. We have this own kind of special language that we use that can sometimes make things difficult. For a patient to really give consent on something though, they have to understand what you're talking about. So sometimes we have to talk in more familiar terms for patients so they can understand what we need to do. It's a very important thing, especially like in surgery, to make sure that they understand the risks that are associated with it. But even when a patient's hospitalized with COVID, they have to understand that if a treatment is experimental, that it's experimental and it's not something that's been approved by like the FDA or any other oversight agency. So it's a very important aspect. The doctor has to make sure that they are being very thorough, and they have to make sure that the patient understands what's happening.
And once the patient does understand what's happening, how important is that for that patient to make the decision whether yes, they want to do this or no, they want to do this?
It's extremely important. As a medical doctor, I tell people all the time, my job is I'm really a good person to give information. But at the end of the day, it's your decision, it's your call on what treatments that you want to have done to you. You might decide that a specific treatment isn't what you want to go for. And it's not my job as a doctor to sway you either way. It's my job to teach you and to say, this is what the benefits are, these are the risks of all the different options that are available, and that's kind of how it goes. You might need to make that decision with loved ones. You might need to make that decisions after some contemplation. Whatever you need to have done to help make that decision, that's completely reasonable. But as a doctor, it's not really our job to sway you one way or another towards a specific treatment.
And I think that's important, that you don't walk into the hospital and lose your rights. You have every right to make the decision for yourself. Wonderful. We had talked earlier about weight loss. It is a new year. What kind of weight loss tips do you have for our viewers out there?
So weight loss is always something that all of us are struggling. Even Dr. Summers, as he's sitting here, would sure like to lose a few pounds. That'd be wonderful. There's a couple of different things that you can do to keep yourself trim and to help kind of with this new year. The biggest thing is to set goals, to set clear, defined, very attainable goals. Don't make things that are very difficult. Often patients will come into me and they'll say, oh, I want to lose 10 pounds in a month. While that would be amazing and that would be awesome, and I would really like to see someone doing that, that's very unrealistic of a goal to be setting. Most of the time you want to set about a pound of weight loss a week, but sometimes you might even have to do a half pound depending upon what you can do. The next thing is activity. People really underestimate the amount of time that they need to invest in order to lose weight. The guidelines right now currently say about 75 minutes of vigorous activity 3 times a week is what's needed to lose that amount of weight. Vigorous activity is something that breaks your heart rate up above about 80% of what guidelines would be. So for a young man like me, that's about 130 beats per minute, and that's pretty quick for me to be going. Doing that for about 75 minutes is what's important. Finally, the last thing is eating. There's definitely no diet that's been shown to cause the most weight loss. There are definitely ones that can assist, but most of the time with dieting, what ends up happening is when you restrict calories to such an extreme amount or in different types of calories you try to avoid, when you reintroduce those or you go back to regular eating, you tend to gain all that weight back. So I don't necessarily encourage dieting in my patients. What I encourage is portion control to help minimize how much that you're taking in and trying to reduce that as much as possible. You'd be surprised how much small little changes make a difference in weight loss. A lot of my patients, I'll say, hey, if you stop just drinking in sugary beverages, that'll make all the difference. For some patients, I say, hey, some of these starchy foods that you're eating in excess. How about we minimize that? And you can see pretty good results. The biggest thing, small, very easy to goals tend to make people more focused and able to do what they need to do to lose the weight.
Excellent. We want to remind you that our phone lines are open tonight, 800-337-4788, if you have a question for our Dr. Summers tonight. Let's talk about family history and why that's important to know what your family history is.
Yeah, so family history is one of the key aspects of a medical history, along with social history, surgical history, medical history, and then substance use history. Family history plays a massive role in kind of helping make decisions for doctors in knowing kind of what has been seen in the past. A lot of diseases have a genetic predisposition, and if your parents had a disease or grandparents had a disease, the likelihood of you carrying that same gene is higher. And so we want to know kind of if there's a risk factor associated with them. There's also extremely strong genetic diseases, in which case we have to specifically know, yes, we have to look out for this disease and screen that individual for that disease. I'll give you a great example is in colon cancer. A lot of people don't realize that if you have a family member that had colon cancer when they were younger, say under the age of 50, your screening guidelines change and you have to be screened even earlier than the average person. They say about 10 years before the diagnosis of that individual. So if grandpa had colon cancer at 45, you actually need to start colonoscopies or other colon cancer screening at 35. So it does make a big difference in regards to it. So it's really important to talk about your family history with your doctor. A lot of them collect it in a like a form that you fill out before you see them, but make sure to address it. Make sure to kind of bring out your knowledge about your family and your relatives, because that really does help influence what a doctor does to help you.
And how important is screening?
Screening is really important. It's a huge key thing what I do as a family doctor. I think that one of the primary goals that I have whenever I see a patient for an annual examination is to make sure that we've reviewed screening guidelines for their age, whether that be screening for cancers, whether that be screening for like depression, anxiety. All are very crucial and very important. We also screen individuals when it comes to vaccinations to make sure that they're up to date. We've had multiple patients that needed like pneumonia vaccines, they needed shingles vaccines, they needed something, and by doing that appropriate screening, we're helping prevent any kind of comorbid situations and helping improve lives, really.
And what might you say to somebody who maybe suspects something is not right, but they're too scared to go to the doctor? What do you say to that person?
So the biggest thing that I can give people advice for in regards to that is to write things out, write them down. When you're not really worried about seeing the doctor, anything like that. I have several patients who, when they come in, they get so nervous, their blood pressure skyrockets, they don't know what to say. And they have this list of things that they've written down, so I can grab the list from them, look over it, read it, and kind of go over what their concerns are. It works very effectively because I'm able to answer what their concerns are. They don't get that kind of social phobia where they feel kind of pressured, they feel like they're not getting things taken care of. They're able to address things. I encourage people all the time, if you ever have problems with forgetfulness, if you have problems with anxiety, anything like that, write out what you want to do. As a doctor, it takes me literally a minute, 2 minutes to sit and read what you've written to me, and it makes all the difference in choosing how to take care of you.
Now, we were talking about how to boost your immunity. What are some foods that are good for, or you were talking about portion control, what are some good foods that somebody can add into their diet?
Sure. Some of the best foods to add are the ones that are found in like the fruit and vegetable category, especially like citrus fruits. They're very high in vitamin C. They're great to add into there. The green leafy vegetables always have a ton of folic acid. They have zinc in them. They have vitamin C as well, so they're great to add into your diet. Anything that has a lot of fiber too is really important to add in your diet. So like legumes, beans, those kind of things are great to add also. Any kind of substitutions that you make with those things are big and beneficial for sure.
And you talked about getting plenty of exercise. How important on the other flip side is sleep or rest?
Yeah, so one important thing I failed to mention, thank you for bringing that up, Jim. Sleep is extremely important. They recommend between 6 to 8 hours for most adults. However, if you're younger than 18 years of age, your sleep is needed even more. Individuals in their teenage years need anywhere between about 8 to 10 hours. Younger kids can need all the way up to 11 to 12 hours of sleep sometimes. And then, of course, as you get older, our elderly population needs more sleep as well. The problem is a lot of us suffer from difficulties with either staying asleep, falling asleep, or having to get up in the middle of the night. What I encourage most people to do is to set a very good sleep cycle, a very good sleep habit. So make sure that the room that you sleep in is dark, it's comfortable, warm or cold, whatever you like more of. Make sure that you have the ability to get up and go to a bathroom very easily and be able to get yourself back to sleep. For some people, they have to have like a little bit of noise in the background. The big thing that I tell them is make sure that it's not noise that's coming from some blue screen, like a phone, a tablet, or a TV, as blue light can sometimes irritate the eyes and make it hard to fall asleep. And then also to make sure that the noise doesn't have human voices in it. Our bodies are very specifically tuned to the human kind of frequency and the voice that we make, and so it's very hard sometimes to sleep when human voices are being talked in. There's some great kind of tools that you can use, like on social media or online, for like sleep aid, whether that be like gentle, quiet voices. Some people really like to fall asleep to rain. All are great options.
Excellent. Very good information today. We covered a lot. Our thanks goes out to Dr. Tyrell Summers from the Russell Regional Hospital. On our next Doctors on Call, we'll be discussing chiropractic and health analysis. You can also email questions for our next program. That address is doctors@shptv.org. Thank you for joining us. For Doctors on Call, I'm Jenna Miller.
Presentation of Doctors on Call on Smoky Hills PBS is made possible in part by an underwriting grant from At Blue Cross Blue Shield of Kansas. We're committed to being a healthcare partner you can turn to. That's why we're simplifying the health insurance experience so you can feel more empowered in your health.
Hutchinson Regional Healthcare System. Our family caring for yours.
At Osborne County Memorial Hospital, our services range from clinic visits to inpatient and skilled care, but our specialty is you.
Your family is our family. The staff at Smith County Memorial Hospital wants to set the standard of excellence for healthcare in north central Kansas.
Russell Regional Hospital, experts, neighbors, friends.